Each year there's an estimated $60 billion worth of wasted spending in Medicare fraud alone. And it's not just the uninsured who cost us all money. Low reimbursement rates by Medicare to doctors increase the cost of private plans for families, for the typical family, to the tune of $1,500 a year. Also, 40% of doctors are not accepting new Medicare patients. Many seniors often choose private plans, such as Medicare Advantage, to get appropriate levels of coverage and to get complete coverage. It seems to me the government's been running Medicare for about the last 40 years, and it really hasn't been getting any better. So my question is, how will adding yet another government plan reduce costs when the current plan is mismanaged and not working very well?
What are you talking about?
And what can you do? And what will you do to ensure us that we can trust the government to properly manage a plan?
Yes, sir. Could you repeat that at the very end, make sure I have the exact question? I got everything building up, but I want to make sure I do.
Okay. My question was, how will adding another government plan help reduce costs when the current system is basically mismanaged and there's so much fraud and abuse within the system? So why would we trust you to continue? Turn it over.
He's absolutely right in terms of we have to do so much better at Medicare, Medicaid. There has been a Dartmouth study that some disagree with, but nevertheless says that 33% of Medicare is inefficiencies. For example, in San Francisco, we pay per Medicare patient about $8,000. I'm off $500 or $600. But down in Miami, it's about $16,000. How come the disparity, for example? All right? And that's why $550 million of this initial, in the last 8 months, we found in savings to begin to chip away at that. If you find 5% of savings out of that 33%, that comes to be close to $2 trillion that we can save over 10 years. So I have to take what he says. Let's take doctors. Doctors this year are going to be cut 21% in the reimbursements. And they're not going to stay like you pointed out. Last year was 11%. So what do we do? Well, first off, that's why the public health care plan option is not subsidized by the government. It's subsidized by the premiums and co-pays of those who join it. We just aren't going to pay $23 million for the CEO to run it. And so, it's actually not. I want to correct one thing. There is, to get it started, and I want to be right up front, people say I shouldn't bring it up, it complicates what you need, I want to be clear. There is a loan amortized over 10 years that must be paid back to get it going. But other than that, it's completely funded by those who decide to join it. It's just that much like you find people, for whatever reason, much like they join the military because they want to serve, people actually join Medicare or other things because they want to help out. You'll find someone who wants to run this out of the goodness of their hearts, like this general physician here who does stuff, who is very competent to run it and is not happy to have $23 million or severance pay of $50 to $70 million. And those are just the beginning of some of the efficiencies that this plan will do. So it really is just a different way of having competition. But certainly, getting Medicare to change also from fee-for-service to being, you still have some fee-for-service, but beginning also to get preventive care and getting them reimbursed for preventive care, like I talked here, is part of the effort to